So we see a range of things. We see some new onset problems like trouble with their bladder, some incontinence, urinary tract infections, things that are very common. In boys, we'll see things like varicocele, so dilatation of the veins in their scrotum, or problems with their foreskin. In girls, it's more common to come across things like voiding dysfunction, trouble with their bladder, and urinary tract infections. So there are lots of common things. So boys and girls both have trouble with their bladders. Urinary tract infections tend to be more common in girls. And so when we see those in boys, we'll usually be slightly more proactive in investigating those because we're worried about a cause. There are obvious things such as problems with foreskins or problems with the veins in the scrotum or testes themselves that are very boy specific. But there are lots of commonality. It's really important that if boys and girls have problems, they come and see us. Girls are much better at doing so. Boys tend to less, so perhaps need a bit more encouragement to come and see us. When we see patients who have bladder problems or urinary tract infections, it's really important that we get baseline data from them. And the way that we do that is by sending them home with something called a frequency volume chart. We ask them to write down how much they're drinking, how much they're weeing over the course of really 3 separate days, so that we can look at what their function's really like. If you asked me how much I drank and how often I peed yesterday, I could give you a rough idea, but I couldn't give you any specifics. And this is really to help us get specifics. We use lots of other things too, so we'll use urine culture, we'll use ultrasound, and when they come to clinic, we'll want to examine them properly ourselves so that we can try and understand what the problem is for them. There's lots of treatments for the conditions we see. Some of the patients that we see will have had something right from childhood. They can be extremely complex, and so actually our treatment is really about looking after them, keeping an eye on them and surveying them. For those patients presenting with newer conditions that may be less complex or less long-term, then we'll look with them about different treatment options that are going to be right for them. Sometimes it's just changing the way that they live their life, so lifestyle advice. Sometimes it's using medication, and sometimes it's surgery. But we offer them the range and we try to tailor it to what they think is going to work best for them. The most important thing is to understand that that's something that's necessary for them. When you've had something that's been really complex and you've had a lot of treatment in childhood, it is likely that you'll need some treatment in adulthood. The amount may vary, but passing responsibility from the parents in terms of making decisions and looking after that child to the child themselves as they become an adult is really important. Finding people who are interested in looking after them in that phase is also important. It's not the same as going to a general urology clinic and being muddled in with everybody else. Some of the specifics that they need are different, and that's something that we work very hard to offer.